Today, we are going to discuss a important topic in radiology, that is the radiographic positioning. As we all know, in radiology, radiographic positioning is more important. Okay, so before that, you have to know what are the anatomical terminologies related to that. Terminologies means the scientific terms which we are using to describe a body part or a position. Okay, when we are describing our body part scientifically, okay, it is divided into different aspects. Okay, first we can say the anterior aspect. Anterior aspect means when we are viewing a patient from the front side, that means the front part of the body. Okay, because in radiographic positioning, we must be thorough with these basic terms. Coming on to the next term, that is the posterior or the dorsal aspect. That means when we are viewing a patient from the back side, or means back part of the patient, is called as the posterior or dorsal aspect. Is that clear? So we are moving on to the next slide. In this slide, we will be discussing about the lateral aspect. Lateral aspect means when we are viewing the patient from the sidewise, side direction. Okay. The side of the head would therefore be the lateral aspect of the cranium. Okay. That means the side part of the head is called as the lateral part of the cranium. Clear? Then moving on to the next term. Moving on to the next anatomical term, that is the medial aspect. Okay. Medial aspect means if you are taking our body, that means the sternum is the medial part, like that. Okay. So now we will be moving on to the next term, next slide. Positioning terminology. Positioning terminology means how we will be positioning a patient. So we are going to describe each and every terminology, how we are going to position a patient for a radiograph. Okay. So moving on to the body position, the first and the most important position is the decubitus. That means a patient when a patient is on the lying down position. Okay. So decubitus, there are many types of decubitus position. The first one is the supine position, or it is known as the dorsal decubitus. It is called as dorsal decubitus because when the patient is supinated in the X-ray table, the back side, that means the posterior side of the body, will be in contact with the table. Moving on to the next body position, that is the prone position. Prone position means directly opposite to supine. That means the patient will be facing downwards, or means the front part of the patient will be in contact with the table. It is also termed as ventral decubitus. Okay. Then moving on to the next term, that is the lateral decubitus. If we are rotating a patient towards sidewise, that means towards right or left, it is termed as lateral decubitus. If you are positioning a patient, or if you are rotating a patient towards the right side, it is termed as right lateral decubitus. The next term is semi-recumbent position, or it is known as the reclining position. Okay. In this condition, the patient is not completely supinated, or patient is not completely in the sitting erect position. In between that, a particular angulation will be there, or the head part will be elevated. Okay, that is known as the semi-recumbent position. And the next thing is the Trendelenburg position. Here, the patient will be first of all supinated or flat, okay, in a table. Then the feet of the patient will be elevated above the head. That means the height of the feet will be above the head part. Okay, the elevation or the inclined angle will be almost 15 to 30 degree. Okay. Next, we are going to discuss about the another, oh sorry, here we are projecting some of the images of these body positions like supine, prone, and these lateral recumbent positions. Okay. Then we will be moving on to the next slide. This is the semi-erect position. Okay. There are two erect positions, that is the standing erect position and the sitting erect position. This is known as sitting erect or semi-erect. Here, the trunk of the body and the head of the patient is in 90 degree. Okay. In the image itself, you can see that the patient is in 90 degree angle. Okay. Then we are going to the next slide. In this slide, we will be saying about the terminologies used to describe the limb position. Limb means our body parts, like our hand, knees, and all. There is upper limb and lower limb. So we are going to describe about the limb position. First of all, extension. Here we can, in this image, we can see that the patient is extending his elbow. In that condition, the angle of the joint is increasing actually. Flexion means what? The patient is bending the elbow joint, or the angle of the joint is decreasing in this condition. Okay. Then abduction means refers to a movement away from the midline. If you are moving a body part, that means, for example, when we are taking shoulder AP, we will be moving our hand towards the, sorry, we will be moving our hand away from the body. That is known as abduction. Adduction means a movement towards the midline of the body. So these are all the description for limb positioning. Okay. And the next important limb positioning is the rotation. Okay. Medial rotation and then lateral rotation. These are all actually very simple terms. Then we can say the pronation and supination. Here in this image, we are showing the pronation and supination of the hand and forearm. Okay. In pronation, the palm is moved from facing anteriorly to posteriorly. What is pronation? For example, if you are taking a hand PA X-ray, okay, it will be placed in prone position. Prone position means the inside, the palm of the hand will be in contact with the cassette. Okay. Supination means directly opposite to that particular position is called supination. That means the posterior aspect of the hand will be in contact with the cassette. So we will be moving on to the next topic. Okay. That is the projection terminology. Projection terminology means it is described as the direction of central ray relative to the aspects and planes of the body. That means how or through which direction the central ray is entering to the patient's body. For example, anti-posterior. These are some of the basic terms which we can hear when we are working in a radiology department. Okay, so all the radiographers will be familiar with this basic term, anterior, posterior. In the first image, we can see that it is a AP positioning, AP erect positioning. We can say that chest AP. Okay, here the central ray will be entering from the anterior aspect of the patient and it will be exiting through the posterior aspect. Okay, so how the central ray is entering, in through which aspect of the patient's body central ray is entering and through which plane. These are the main things which we are describing in projection terminology. Moving on to the posterior anterior projection, that is the PA. Here, the central ray will be entering from the, or the ray will be entering through the posterior aspect. That means back side of the patient, and it will be exiting through the anterior aspect of the patient. Is that clear? Then Moving on to the next slide. This is known as the lateral projection. In lateral projection, it will be entering from the one lateral side and it will be exiting through the lateral side. Two conditions are there: left lateral projection and right lateral projection. Actually, these are all very easy terms, so there is no need of detailed explanations and all. So we can move to the next slide. Okay, here we are depicting the images of lateral projections, right lateral projection and the left lateral projection. Okay, then this is known as the oblique projection. Okay, so in this oblique projection, we have to know how the central ray is passing, through which all planes the central ray is passing. Okay, you can see the particular image here. This image is known as the anterior oblique image. So how we are naming that particular projection? Here, the torso which is in contact with the image receptor. According to that, we will be naming that particular projection. Here you can see that the anterior aspect of the patient's shoulder is in contact with the cassette or the receptor. Okay. Then the remaining part will be obliquely tilted. Oblique projection means the angulation will be in between 0 and 90 degree. So from the PA position, if the patient is rotated towards 90 degree, then it becomes lateral projection. Here, it will be in between 0 and 90 degree. Clear? So we are going to towards next projection. That is the posterior anterior projection. Okay, moving on to the next slide. That is the posterior oblique projection, or posterior oblique projection means the posterior part of the patient's shoulder is in contact with the X-ray table. And the next part, that means the unaffected part, will be slightly rotated. Clear now? Okay. So we will be moving on to the next page. That is the planes of the body. So these things and all we can mainly see in MRI and all. Okay, planes of the body. That means how we will be dividing our body into different parts. Okay, there are actually three important planes we are going to discuss. That will be discussed in the upcoming slide. So we'll be moving to the next slide, moving on to the next slide. Okay, first, that is the median sagittal plane. The second one is the coronal plane. The third one is termed as transverse or axial. We will be describing that in the upcoming slide. So, this is the median sagittal plane. Median sagittal plane means if you are dividing a particular body part into equal right and left halves. Okay, clear now? Then another term is also there, that is parasagittal plane. That means if you are dividing the body into two unequal halves, that is termed as the parasagittal plane. Okay, is that clear? This is the image of the sagittal plane. Okay, that means the body part is, that means the head region, that is divided into left and right. Then the second one is the coronal plane. Coronal plane means the body or that part will be divided into anterior and posterior. So this is the image of the coronal plane. Okay, moving on to the last important plane, that is known as the transverse or the axial plane. You can see that in the next slide. We are dividing that particular part into superior and inferior. That is known as a transverse or axial plane. So these are all the basic things which you need to know when we are going to study about the radiographic positioning. Okay. Here we can see that in PA projection of the hand, how we are positioning the limb. That we have to know how we are positioning the limb. PA means posterior anterior projection of the hand. Here we know that The central ray is entering through the posterior aspect of the hand and exiting through the palm. That means the palm of the patient hand is in contact with the cassette. So the incident ray will be entering through the posterior aspect. So what will be the correct answer actually? Okay, this is not at all inverted or head position. Here we know that actually it is pronated. Okay, the anterior part of the hand, that means the palm of the hand is in contact with the cassette. Okay, so it is termed as pronation of the hand. Is that clear? So one more basic question we are going to discuss that is related to this basic projection only. So what is the position when a patient lies flat on their back and the head is lower than the feet? Okay, so we can discuss the options. This is not lateral recumbent because lateral recumbent means we will be rotating a patient towards the side. Okay. And the next option, that is the Fowler's or semi-recumbent. Okay, this is not the condition for a semi-recumbent position. Then this is not at all simple position. Here, we are telling the one important thing that the head is lower than the feet or the feet is elevated actually. Then the answer is Trendelenburg position. Actually, in Trendelenburg position, the patient will be supinated or flat. Then the feet will be elevated. That angulation is 15 to 30 degree though. So the height of the feet will be higher than the head. Okay. So we can see that particular image, okay, of Trendelenburg position. So that is known as the Trendelenburg position. Here, the feet is elevated. So the height of the head is lower than the feet. So in this type of licensing exams, we need to know the theoretical portion. Then only we can attend the mock questions and all. We have to know in detail about the theoretical aspects. Okay. Okay.